Missouri's public health system faces multiple challenges. A decentralized structure with 114 autonomous local public health agencies, a complex funding mechanism, increasing demand for services with inadequate resources, and consistent state and federal funding cuts weakening the system. In fact, Missouri currently ranks second to last in the nation in state general revenue budgeted for public health programs and services, allocating only $5.88 per person each year. At the same time, Missouri spends nearly $7,000 per person each year in healthcare costs, and nearly 75% of those costs are for preventable conditions. The result? Missouri ranks among the lowest 10 states in the nation on health indicators including adult smoking, violent crime, cancer deaths, cardiovascular deaths, and child and adolescent immunizations. But Missouri has hope. With support from public health stakeholders across the Show Me State and funding from Missouri Foundation for Health and Health Forward Foundation, Missouri has embarked on a grassroots effort to transform its public health system into a stronger, more sustainable, culturally relevant, and responsive system that can meet the challenges of Missouri's diverse communities and offer every Missourian the opportunity for a healthier life. The Healthier Mo initiative launched in October of 2017 with 3 goals: to gather stakeholder input on priority public health system issues that must be addressed first, to enlist active participation and input from stakeholders, and to explore the strategic alignment of Missouri's professional organizations focused on public health. During a large convening session of stakeholders in March 2018, stakeholders identified priority public health system focus areas as stable and increasing funding, a unified voice focused on priority issues, and higher quality and more consistent operations. The group also recommended forming a diverse advisory council made up of stakeholders with a fresh perspective and a commitment to improving public health. Based on this input, the steering committee and initiative staff developed a funding proposal for Phase 2 of the initiative. The advisory council was then convened to review the proposal, make adjustments, and submit a final funding request recommendation to the executive committee. Meanwhile, the initiative facilitated meetings between Missouri's professional organizations focused on public health to explore strategic alignment. From the very first meeting, the professional organizations committed to working together for the benefit of public health, agreeing that they would be stronger together than they would be individually. The group quickly chose the vision United for Public Health and the mission statement, Leading Public Health Collective Impact Through Advocacy, Collaboration, Communication, and Workforce Development. At the same time, a communications committee with diverse expertise shaped communication efforts designed to inform, build support, and engage stakeholders in active participation that will eventually lead to ownership of the initiative. An evaluation team began collecting outcomes and processing data, and representatives from Missouri's practice-based research network offered guidance on the evaluation process. Phase 1 was designed to engage stakeholders and solicit their input on a long-term process to transform the public health system. As Phase 1 wrapped up in December 2018, a Phase 2 funding proposal was presented to the foundations for consideration. Missouri Department of Health and Senior Services demonstrated their level of support for the initiative by providing short-term bridge funding while the proposal was being considered. This important bridge funding allowed staff to continue communication and planning efforts and to sustain momentum in the initiative through January 2019. In February 2019, the Phase 2 proposal was approved for funding by the foundations. The 24-month Phase 2 work will center around developing a foundational public health services model specific to Missouri. A work group of public health system representatives will review the national model and models from other states before developing a model that best fits Missouri's unique needs. A public health system capacity assessment will then be conducted to identify gaps between the current system and the foundational public health services model. Finally, a plan for adopting and implementing the model will be developed by the work group. Throughout the process, public health stakeholders will have opportunities to provide input and feedback. The initiative understands that for this grassroots initiative to succeed, public health system stakeholders from every corner of the state must be actively involved. While the foundational public health services model is being developed, the professional organizations group will continue working to achieve collective impact that strengthens and enhances the public health system in Missouri. It has formed work groups to address 10 goals under its 4 mission areas. The Advocacy Work Group will identify priority public health issues to champion among legislators. The Collaboration Work Group will design a formal structure for the group and develop a sustainability plan. The Communication Work Group will develop a process for sharing and gathering information among the organizations and their members. The Workforce Development Work Group will develop a master calendar for professional development and training, identify collaboration opportunities, and create public health workforce recruiting strategies. The initiative's Communications Committee will continue to inform communication strategies. It will develop a values-based brand that empowers public health employees to become stronger ambassadors for public health, using new tools and resources to reframe conversations around the reach and value of public health, and enabling collaboration building with local partners. It will use storytelling to emphasize how public health must be integrated into every part of a thriving community. As they build strong community partnerships, local public health agencies can fill a chief health strategist role and begin to imagine and facilitate local changes that will lead to improved outcomes and stronger support for public health. This groundswell of support will be vital to encouraging policy development and achieving systems-level change that leads to a stronger public health system and the opportunity for every Missourian to choose a healthier life.